So I'm gonna call the meeting to order. We're just gonna do a roll call here, just make sure everybody's here. Oh, I see. So just say here, Ashley Craner.
There it is, here.
George Hegeman. He was here. Where'd he go?
He was there.
He's gone.
He's here.
He's like over it.
I saw him.
He was here.
He was.
Yeah, he was here.
Yeah, well, we'll just continue. Kay Leach,
Here.
Mark Norrell.
I'm here.
Oh, there he comes again. Steve Pritchard,
Here.
George Hegeman. I saw your voice. I saw your lips move.
Here.
Bob Wren.
Here.
And I'm Carol Talukian. So we're all here. And we also have with us Penny Cottle.
Good evening.
And I think Kirk White is here with the student. Dr. Sharp is with you, right, Penny?
He is.
Yes, I am.
Okay. And Kirk White from IU is here as well. I don't think we're, hello. And Jonathan Stewart from, who's our wait, no, Lee Baker. There we go. Hello. Lee Baker, who's our league representative. Anybody else I need to introduce? Penny, did I get everybody?
No, I think we've got everybody introduced.
Okay, so first order of business is approval of the February 10th meeting minutes. You all should have gotten them by email. Any changes or corrections that anybody has? Not hearing any, I will entertain a motion to accept those.
So move.
Okay, moved, and I need a second.
I'll second.
I have George for a second. Thank you. Okay, then we'll go to public health reports. Our first one is Kirk White from IU. We're excited to hear how things are going at IU.
You'll need to do a you'll need to take a roll call on that for to approve the minutes
Again? Oh, okay.
from everybody. Mhm.
All right. So, okay, let's do this again. So Ashley?
Yeah.
Yes. Okay. George?
Yes.
Kay?
Yes.
Mark?
Yes.
Steve?
Yes.
Bob?
Yes.
And I say yes. Okay, thank you. Keep me in line, Penny, whatever you do. Okay. Now, Kirk, now it's your turn.
Well, thanks, Dr. Talukian. Hello, everybody. It's good to see you all. What I've been doing, and I'll continue at this meeting, is just to give you an update about what's happening at the campus so that you can have that information for your deliberations. Our case counts have just fallen through the floor, thankfully. Last week, we only had a total of 29 cases on the campus. And of course, that's a huge decrease from where we were back in January, where we had over 800. So certainly the Omicron spike is leaving us, and that's a good thing. We're on track. As we announced last week, we're expecting to rescind the masking requirement on the campus and make masking optional. And we're working hard to communicate how that works, including a big promotion campaign for one-way masking. And so we've sent a couple of communications out to explain that one-way masking is a good way to protect yourself and others. And you should be quite happy and comfortable doing that. And if that's what folks are comfortable with, they should continue to do masking for themselves. Even though the masking requirement is planned to go away for the university, and that's university-wide at all of our campuses across the state tomorrow night, we're going to continue all of those mitigation efforts that we've had in place since we got spooled up with the pandemic in the summer of 2020. So that means that we'll continue to have vaccines available at the Student Health Center. Right now, we've got quite an adequate supply of Pfizer to continue doing that. And I know the last I checked on Monday, we had 17 appointments. And that's pretty good because, we have this high vaccination rate. People are still coming in for boosters. And of course, we have the incentive program for boosters for students. They get a $20 credit on their Crimson Cash if they come in and get a booster or prove that they've gotten a booster, submit that information. So that's how we're encouraging that among the student population. Our testing requirement for non-vaccinated individuals will stay in place. We'll continue mask distribution. And I'm not sure if I had updated you since the last meeting, but we have a very adequate supply of KN95 masks that are available just to pick up at Gym 171. So anybody who wants one can come by and get them. We're stocked up and have been distributing those well. We'll continue with contact tracing, and we'll continue with quarantine and isolation, our quarantine and isolation facility. That is our current plan. And of course, as the numbers continue to get better, and we hope they do, we'll continue to look at that and see if we still need to do all that stuff. But right now, that's the plan to move forward. So we're specifically watching closely what might happen after spring break. Lots of folks kind of, predicted bumps after, storming basketball courts and other kinds of things, which really didn't seem to be a big problem. Spring break's a little different with people going all over the place. So we'll keep an eye on that week of the 21st and watch our testing and infection rates, and we'll be ready for any of those contingencies should they happen. So that's our report for the week, and happy to answer any questions.
I have a question for Kirk. Actually, one thing I just read is that the medical school is still going to require masks. I just read that. And then we have a fair number of medical students on our campus here. How's that going to work?
Well, if you're in a clinical setting, we're quite happy with you requiring masks. Where there is, patient contact, that sort of thing, it needs that level of protection. That's okay. So in clinical settings, at our quarantine and isolation facility, that staff's at will continue to mask. And of course, there's still a TSA requirement for mass transit that, as last I checked, is in effect until the 18th. And so that means that campus buses will continue to have a mask requirement.
Actually, the email I just got said that the medical students are required to wear masks in the classroom as well.
Wow, I wasn't aware of that.
I just got that like a few months ago.
Yeah,
So,
I'll have to check on that. I didn't know that.
So what happens if, let's say there's a professor that is at, like, say, older, health risk, whatever, can that professor require masks in their classrooms?
Not right now. What we're asking, if a faculty member has a particular medical condition that requires some special circumstances, that they discuss that with the academic affairs staff, who will then discuss it with Dr. Carroll, at Chief Health Officer, and if things need to go on online or a different platform or whatever for a while, then we'll take a look at those things individually.
Anybody else have any questions for Kirk White about IU? Not seeing any.
Well, thanks for sharing that with the board. Appreciate that.
Yes, thanks
Pleasure
for
to do it.
coming. We always appreciate your input and know what's going on throughout the town. So
Happy to share. Thank you.
And
Thank you.
appreciate how much they've been on top of things.
okay. So the next item on our agenda is administration. That would be Penny.
Yeah, and I'm going to keep it brief tonight as well, since I know this meeting was really about the regulation. The only non-COVID thing that I want to mention, and I sent you some information legislatively, House Bill 1245 dealing with septics is likely to pass, it looks like. So we have, as local health departments across the state have submitted feedback and information about that and what that may mean for us. So there are certainly some concerns. It takes away some of the ability of the health department and puts it in the private sector. So there are some concerns about that. So I just wanted to raise that, elevate that bill to you a little bit tonight, since that is kind of the hot topic with the House now. So wanted to mention that. In terms of public health clinic, just a few notes from them. We do continue to see vaccination appointments for our specialized COVID clinics dropping. They're still seeing people every day. That they did report that we're even seeing more people who are coming in for their first dose. So that's a good thing, but the numbers are dropping. So we will continue to merge those appointments into our normal routine. So we won't necessarily have separate COVID vaccine clinics, but they'll just be a part of our normal vaccination clinic. So our nurses will be able to make appointments for them, as well as other vaccines that are available. Lots of outreaches are being planned for the community. And one of the big things coming up are the spring school clinics. And these will be a lot of the catch-up vaccine clinics, especially for our 5th graders, so that we can get those children caught up on their vaccinations as they enter that next phase of school. So we'll be working hard on that. And then on the a little bit sadder note, Amy, our current nurse manager, has been, prior to COVID, was part-time manager for us, and she was part-time nurse family partnership coordinator. And so with COVID, we kind of took her back full-time, right? And so she's going to be transitioning back and actually going to nurse family partnership full-time. And they will be hiring a replacement. So a full-time manager for the public health clinic. They're interviewing, finishing up those interviews. So hopefully by your next meeting, we'll have that person on board and ready to introduce you to them. The good thing, we will miss Amy immensely, but the good thing is she will be right down the hall and able to transition and train that new person. So she really won't be leaving us. She's still going to be at IU Health. She'll still be in the same building. She'll just be in a little bit different office. So we're happy for her. She really does love the work that she does with Nurse Family Partnership. And I think it will be hard for her to leave the other public health clinic things, but her passion is really with that Nurse Family Partnership. So we're happy for her there. And before we move into kind of the regulation review and things, I have just a couple of things that I want to add. I have just a few slides to share with you, but a couple other things that I wanted to share. Our community transmission indicators are very, very good right now. There's been lots of improvement since our last meeting, so I'm happy to share that. And this week, our 2-score metric is in yellow. Now, the advisory that we were looking at, that is still orange. So if you're looking at the advisory level, and I think at the last meeting, we may have touched on this, that advisory is a little less relevant now because of Omicron's steep decline. So back when we had that roller coaster of up and down, it made a lot of sense to have a 2-week hold before you changed colors and de-escalated right into your level. But now that Omicron just is a steep decline, that's really less relevant. So just wanted to point that out. This week in our metrics, we had 43 cases per 100,000. And to put that in perspective, on the 16th of February, we were at 310. On the 23rd, we were at 175, and this week we were at 43. So a steep decline. Our positivity rate this week, and again, this is looking back over the last week or so, was 5.89%. If you look at the dashboard today, and this is a rolling 7-day average, it is at 4.6%. So we're seeing lots of improvement, and I would expect that the 2-score metric could very well be blue next week. The CDC did come out with new guidance as we move into a new phase. And I just want to point out that the data that they're using, while accurate, lags behind even the state data. So when you look at that CDC, map, you'll see us as red or high level, but they're also, if you look at those numbers very closely, they're about 3 weeks behind. So just something else that I wanted to put in perspective, and that CDC map is updated on Thursdays, but prior to this meeting, it had not yet been updated. So that's what I have in terms of general. And then when you're ready for me to just give you my kind of COVID update related to regulations, I will do that.
Anybody have any questions for Penny other than the COVID stuff? Steve?
On COVID testing, I need to get a COVID test before I go to New York University on the 12th, the 11th and 12th. And I can just go to the Gravity Center, right? Which is still out on Profile Parkway or somewhere out there. Yeah.
Yes, and that's in my slides actually. So yeah.
Oh, good. All right. Groovy.
Seeing no other, you want to go ahead with your presentation then?
Sure will. Okay. All right. And can you see that? Because I lose it when I start doing
Yep.
it.
I can see it fine.
Very good. Let's see. Okay. So starting with testing, right? So there's the Gravity site information for you. The Gravity sites will be phased out. So even as the state is starting this demobilization piece and we're moving to a more endemic phase of the pandemic, the Gravity sites will be phased out by April 30th. The mobile clinics that we've had, we've brought in lots of different mobile clinics over the months to do vaccine and testing. And the state purchased 10 of these mobile units. So they will now be available to us for a multitude of things. So it won't just be COVID focused. If we have a hepatitis outbreak, we're dealing with, in 2019, I think hepatitis A. And so we could request those mobile units to come down and help us respond to those kinds of things. Or if we want to have a back to school clinic and we want them to come down and give us some extra help, we could request them for that. We do expect our Gravity site to close the 1st of April. They're rolling them out, phasing them out based on the demand, the amount of how busy they are, as well as kind of the need in the community and what our rates are. As I mentioned before, vaccine is still available. It is waning somewhat. So we'll be folding, in terms of the public health clinic, we'll be folding those special clinics. We'll be phasing those out and moving them into just regular routine vaccination clinics. So you call, you make an appointment, whether you need MMWR or whether somebody needs a COVID vaccine, they'll be able to schedule that appropriately. Our positivity, our cases by day, you can see the big drop. And right now, today our rolling average was at 16 average a day. So yesterday it was right around 20. So you can see that it's continuing to drop. So we're pleased with those numbers. And you had asked to keep updated on the water sampling. So Sarah on our staff is pulling this data. If you remember last month when Vic Kelson was here, he talked about them transitioning from the sampling that they've been doing into the new federal program. So there is a gap and we don't have the newest data, but you can see this steep decline. And so this is the data that's still up and was available for us to pull. Sarah did pull some additional things that we sent to you just that you could pull yourself, but she went ahead and did that for you, but I wanted to share one with you. So this really shows that steep increase that we saw in cases and then the steep decline that we've seen as well. So we'll continue to watch this and use it as a piece of the data that we're using as we assess what's going on in the community. And then our hospital census data is dropping as well. So again, this was pulled a couple of days ago, and when I looked at it today, it was even lower. So the hospital is reporting much better numbers, fewer people coming into the emergency room needing care or inpatient care. And so we're pleased that our hospitals are not as overrun with serious COVID infections, and they can concentrate on other things. So that's certainly one of the goals, even of vaccination, is to keep people out of the hospital and not needing care to that extent. So in summary, so our transmission level has dropped drastically. Again, fewer than 50 cases per 100,000 this week, and today our percent positivity was 4.6%. Given the shift in the pandemic, the CDC did change the metrics used to determine disease burden and recommended mitigation measures in counties. They are now using the number of new cases, and they look at it whether or not it is less than 200 per 100,000 or whether it is 200 or more per 100,000 in the past week based on provider reporting. So this isn't catching your home tests and all of that. It is more like surveillance testing. So it's what we do with lots of other things. We do sort of sampling testing to see what the burden is, what's going on in the activity. The state will continue to do checks for variants so that we can see what's circulating as well. So all the positives that they get, they will be testing and looking at those. But with the CDC's new guidance, you first separate whether you are below 200 or you're 200 or more. And then you look at the number of new patients with COVID-19 that are admitted to the hospital in the past week and the proportion of hospital beds that are devoted to caring for COVID-19 patients. Now, again, you can get this information on the CDC's data tracker, and for counties that don't have hospitals, they are kind of grouping them kind of almost in a district. Like, so they'll be using, Brown County is using our numbers, right? So they're kind of looking at them in that way. We'll continue. We talk every week and sometimes multiple times a week with our hospital so that we get updated current information on what's happening in our local hospital. So we will look at what's going on locally as well as what data the CDC is providing so that we can make sure where they align or where they may be different. At some point, they'll come into alignment, but right now the CDC numbers are higher than what reports we are getting locally. So just in summary, the goal of less than 50 cases per 100,000 that is in your current health regulation has been met. We are not in a blue advisory, but we are near blue in that metric. And if we did it with today's percent positivity, we would be blue. And again, as I mentioned, that advisory map is less relevant to us today than it was then. So our current information indicates that Monroe County is not at a high level and that it would be appropriate for the regulation to move to recommendations. We will continue to monitor the CDC data, the local data, and keep you abreast of that. You can continue to meet as frequently as you want so that you can review that and respond appropriately and as quickly as possible. We did prepare recommendations for you tonight if you want to look at those and approve them. And that's what I have.
I have a question again on testing for people that are listening, or if this ends up something about us in the paper, for people that would need a PCR test and Gravity closes, where can they go to get this test?
They can still go to providers, they can go to pharmacies. And in terms of travel, there are some airlines that are even providing those tests as well.
Yeah, I had my vaccine, my last vaccine done at a CVS down in South Carolina, and it was really well. It was fast. They did a great job.
Yeah, I got mine at Kroger.
Yeah, so the availability is not an issue.
Penny, I'm assuming that the cases are also down throughout our school system.
Yes, they are, and schools are no longer required to report cases or to do contact tracing for them either.
So we
They
really
saw the
don't know.
same, oh, I'm sorry.
We don't know numbers at schools anymore.
Well, the numbers had drastically dropped off, but no, they are not. Well, two things that I will say about that. Schools had to report cases on the school dashboard, which has been changed. The actual reports that counted in the case count had to come from a provider. So they had to be reported that way. So the school report should also correlate to cases that were reported on the dashboard in terms of number of tests, but they weren't necessarily the same. I don't know if that makes some sense, but so the schools, not all the schools were doing testing themselves, right? So they got reports of tests and then they reported how many people were in their building who were positive. So that's what the schools were reporting, which is a little different than who tested positive, right?
So if a child's positive in a classroom, are they still gonna let the other kids in the classroom know, or how's that gonna work?
They recommend, well, there are two things, and there had already been some changes with that, you know, we all need to be acting as though we can come in contact with somebody who is infected at any time. And so they are recommending that if schools can notify a classroom, they could just notify a classroom, for example, or if a school had several cases, they might just notify everybody in that school that, hey, we've had some cases that are in our school, and then people can act accordingly. But they don't have to, they are no longer contact tracing. They're no longer calling individual people to tell them that.
So there's still some information out there about Omicron that a fair number of people have Omicron and don't have any symptoms, just like
Right.
it's all along. So there could be so many more cases than we know of, and they can be spread to other people so easily. So
Right. And so the fact that there could be lots of people who are out there who don't know it, who have mild symptoms, really the purpose in our contact tracing and our interviewing was early on, it was an effective tool and response because we didn't know anything, right? And so we could learn about that. We could do that contact tracing to help. But with Omicron especially, by the time any contact tracing is done, you're beyond, you know, you've spread it to whomever you're going to spread it to. And that's, again, part of what we've learned, but it's why that's not as an effective tool. People should still notify their close contacts. So if I test positive, then I should still notify my close contacts myself, but there isn't going to be, the health department or the schools aren't going to be doing that for you.
any other questions for Penny about this before we move on to the regulation review?
Yes. So it was my understanding, and I may be unclear about this, but I thought that there was a connection between CDC guidance and school districts having to follow that guidance. And so with the metrics, their guidance follows their own metrics. If their metrics are showing a little 3-week lag, does that then mean that, we as a county, we as a county health department and board, we can do whatever we want with regard to regulation. But even if we believe that things are more safe now, that the school districts still have to follow that CDC guidance, and they might have to wait another 3 weeks to relax. Is that my understanding, or am I misunderstanding?
Sort of. Our current regulation says that schools should work with the local health department, the Indiana Department of Health, Department of Education, and the CDC, and that they shall follow the CDC guidelines. So right now, they would be following the CDC guidelines, although I will also say that the current CDC guidelines no longer recommends masks except when you're in areas that are high, right? So on their map at 3 o'clock today, we were still high. We may not be later today, but after that, then, and I can pull up, so then it is really, it's not a mandate, right? So it is more of a recommendation for them. So
Right,
schools
so the
would not have
CDC's
to.
guidance, the
Yeah.
CDC's guidance kind of refers to the local statistics. Right, okay, I got it.
Right, so
Thank you.
even though CDC may be 3 weeks behind, our local isn't, so that's good. That's a good thing. Okay. Anything else before we talk about the regulation? Okay, so next we're going to regulation review and discussion. So correct me if I'm wrong, Penny, but so the regulation will expire tomorrow when the governor's, although we've met,
Yeah, so you can decide. So
we've met
yeah.
what we said in it. So, so does it expire because we met what we said in there? Maybe we can make it clear.
You
to
can
us, but-
decide. Yeah, that when you want it to be effective would be up to you. Right now, we don't know for certain. The expectation that we currently have is that the governor will probably extend the order simply because of the legislation that he wants. And keep in mind, there's nothing requiring masks or anything like that in there now anyway. It just gives you the authority to have that regulation. So if you want to move to recommendations, then you can decide when you want the regulation to repeal. So you could set it to repeal tonight at midnight. Keep in mind that in the current regulation, it would stop when we met those metrics. And normally those are posted on Wednesday. So it was using the advisory map, remember. So it says Wednesday, right, at the end of the day. So you could make it effective tonight. You could make it effective, at 6 a.m. tomorrow morning, or that is totally up to you.
It seems
I
that
understand
we've met our
that-
metrics, so.
The governor's health order, if it was to be extended, yes, there was legislative reasons, but I understood that if it was going to be extended, it was because of funding for some things that had nothing to do with the actual public health emergency. So the continuation of the executive emergency health order is kind of irrelevant now.
This is a big enough issue. I'd like to hear what everybody has to say. I'm going to just go through us one at a time and just tell me what you think about it. Ashley, you're first.
Okay. Well, I think since our numbers are coming down and we're seeing a trend with IU too, and that our numbers are starting to hit the burden that we had set for them, then I'm okay with moving. I feel comfortable moving to a recommendation for our community and our county starting midnight. I mean, I feel pretty confident that the numbers are going the right way. So.
Okay, thanks. George, you're next.
I agree with Ashley. I think basically we're in a good part of the curve at the moment. Of course, there's also the little issue of places like Hong Kong, where the virus is still raising its ugly head in a rather large way. And I would like to see the opportunity to be able to whip the masks out and return to a situation which we may need to return to if we do. But for the moment, I agree completely with Ashley. I think we ought to drop the regulations as of, say, midnight tonight.
Okay, and Kay.
Can agree with that. I'm a little pessimistic because I've traveled and I've seen that with mandates and so forth, people didn't wear their mask and whatnot. And I'm wondering about how effective recommendations will be, but I think I feel that with the numbers down, it's okay for us at midnight to come out with our regulations. But I'm like George, I really want to make sure that if it goes back up, and we have seen it go up and down, if it goes back up, we probably need to meet again and discuss it.
Mark?
I'm fully comfortable with transitioning to a recommendation. And I think the reason is not just because of our low rates, but the fact that the whole country is kind of in this similar position. It's not like there's a lot of variability around the country, and in these, it's like everybody is all of a sudden in this way. So that makes me comfortable. As far as timing goes, I'd like to see that timing be consistent with IU's timing, and their timing is beginning March 4th. So that would be, I suppose, midnight tonight.
Okay, Steve.
Yeah, I agree with everything everybody said. I think that I have no, quite frankly, I have no expectation that many people will be masking once the regulation goes off, even though it's a recommendation. I think that's just a realistic assessment that I'm going to state publicly. I think just given everything that everybody's already talked about, that I'm in agreement with going to the recommendation rather than a regulation and letting it lapse.
Bob?
I'm pretty much in agreement. The requirement versus recommendation, we can hold off on the requirement temporarily and go to recommendation, and with the understanding that we have to see what the numbers produced to decide our future. Okay,
And yeah, I also agree. I think that we're moving from, as Penny has mentioned, from a pandemic to an endemic situation. In that situation, those who are more vulnerable need to take responsibility for their own health and do the multi-layer thing, like wearing masks, socially distancing, doing all those sorts of things. Vaccines are available for people, treatments and testing is available at this point. Hospitalization rates are down. That really impresses me. I think that makes a huge difference. We have capacity. If we do start to have a surge, we have capacity. Although I think, again, like everybody said, we need to watch it closely and keep a real close eye on. If things start to surge back up, we can meet again and change our minds. But I think it's time to do that. And I think we could. So it says here that Kirk says, hi Kirk, says that it goes to effect at midnight tomorrow night. Is that what it says? Or did that say this morning? What did you just say?
Effective 12:15.
Tomorrow night is when we're expecting the state to expire. And it looks like the Indiana House just voted 79-9 to send it to the governor, who's expected to sign it. So looks like it's on track.
Okay, so IU's masks goes through tomorrow, expires tomorrow night.
That's, yeah, well, we could, our current plan is what we thought was what would happen with the state. And the state was scheduled to expire, I think, Penny, tomorrow at 12:59 p.m., midnight, basically. Yeah. Well, I guess that's 11:59, excuse me.
Yeah.
Okay, let me say,
Yeah.
I have no problem going along with IU's recommendation. It's just to make things easier for the whole world.
Right.
Well,
Okay, that was my
today,
misunderstanding. I thought it was midnight tonight, but
Well,
that it should be consistent across IU and Monroe County.
Well, one thing that I will say is I know that the K through 12 schools that we're planning, we're hoping to tomorrow morning. So I will just add that. So when we say, I do think that there was confusion about exactly when the order. So, and this conversation is a good replication of that, I suppose, that a good example that there was confusion about when it would technically end. And so I think some of the K through 12 schools had originally thought that it would end tonight at midnight and tomorrow they would be good to go. So I just bring that up when we talk about putting everybody on the same page.
Well,
So the schools are still midnight tonight then? Is that your understanding?
That was in their plan, yes, because that was their interpretation, I believe.
So we could go, I mean, if we want to coordinate, there's no more argument to coordinate with IU than there is for public schools. Why not do it with the public schools?
I'm fine either way. I don't think a day makes a difference.
Yeah, well, it sounds like it might make a difference for,
It'll make it easy for everybody, basically.
yeah, I think it sounds like it might make a difference for the schools, a day. So, you know, but I'm with you, Carol. I mean, what would Saturday be? But, well, that's interesting. I don't think it's going to be too confusing between Monroe County and IU, you know, in terms of the IU students. I think they'll understand that they got to hang in there one more day.
They can have their own rules completely separate from the county.
Yeah, they do, and they
Yeah,
do.
so.
And so, you know, I'm still with midnight tonight.
I'm okay with that.
I'm
Does
okay with
anybody
that.
have any objection to that? So do we need to vote on that, right?
Yes,
I do have one quick question. So what happens to our compliance officers go away when this goes away, right?
yes.
So they're
They're
paid
cut.
after last night. Okay.
Okay.
All right. So we're going to so I need a motion, I guess, to rescind the current regulation.
George likes to do that.
I move that we rescind the current regulations and move to a recommendation of masking and other measures in a overlapping way to guard against the virus.
I will second that. George.
Effective,
When?
11:59.
George, what time do you want to put on that?
11:59 p.m. tonight.
Okay. And the recommendations we'll talk about afterwards, but I think, so we're voting to go to recommendations, but we can discuss the recommendations after this. Does that work for everybody?
Mhm.
Okay, so we have a motion and a second. Does anybody have any other discussion about this? Okay, we'll do a roll call. Ashley,
Yes.
George,
Yes.
Kay,
Yes.
Mark,
Yes.
Steve,
Yes.
Bob,
Yes, but I think
And I
we
vote yes.
also recognize that have to go 1 week at a time with statistics. If statistics turn around, then we have to open the door to go back to requirements. We're not
Yeah.
giving up the whole game. We're just going to tiptoe through 3 weeks of trial and error. Can that be put in the
Not at this point.
George? Or
we can put that in the recommendations. So we'll be discussing that after we vote on this. So your vote is, Bob, yes?
yes,
And I also vote yes. So it has passed. Her regulation has been removed. Okay. So the next is recommendations. And I think we have a draft.
do you want me to show that?
I do want you to show the draft. And we can, anybody, I think everybody's had a chance to look at it just to see if they had any comments. But we have this, so we'll look at it again. Penny, you want to take it over from here?
Sure. Here, let me see if I can. Can you still see it? Okay. The first portion is really just an introduction where you have it that we've been under a public health emergency. The second and third.
I think it went
Did
away.
it go away?
It went
All
away.
Well, okay.
It was there, but now it's gone.
All right.
There it is
Back
again.
now? Okay.
Yeah, to make it
I've
bigger.
got
Oh,
two
there it is.
screens
Okay,
and I
good.
can't tell where it is. So thank you.
Okay, it's there now.
All right. So the next is really talking about you meeting, and we'll fill in the effective date and change all of that. And then we have the recommendations. So we started with COVID vaccine, and that you strongly recommend staying up to date on all of your COVID vaccines. So we want people not to just get those first 2 doses, but if the boosters are required, if they're immunocompromised and they need an additional dose, we want people to stay up to date on their vaccinations. We know that that's the best way out of this. And so that's what this number 1 talks about. When we talk about face coverings, it's residents should assess the current COVID-19 cases in our community level and their personal comfort level and risk level when making decisions about wearing face coverings. And then it talks about the new CDC's community level metrics, and everyone living in over 2 living in areas with levels of high COVID-19 should wear face coverings when indoor public spaces. And it advises people living in medium to low to consider it based on their personal situation. And then again, currently, there is still a federal order for masks on public transportation. Now, the CDC did remove schools K through 12 do not have to have masks on school buses. Then for isolation and quarantine, stay home if you are ill and get tested. Anyone who's diagnosed should isolate, wear a mask, and follow current recommendations. We know that as recommendations and guidance changes, we don't want to get too in the weeds on this. So please stay up to date. And this, if you are infected and need to isolate, doesn't matter if you are unvaccinated or you're a vaccinated breakthrough case. For quarantine, individuals who are exposed as close contacts should follow whatever the current guidance is. And right now, it is pretty much wear your mask when you're around others, monitor for symptoms, and get tested after day 5. Businesses, the board strongly recommends that businesses post signs encouraging masks, and we have staff have put together a variety of signs that we can send to businesses that range from our business requires masks because they can if they want to please be nice if people are wearing a mask. So there's everything there and in between. I can show you some of those in a moment if you like. Businesses do have the right to require patrons to wear face covering in their business. So if you are asked to do so, please do. K through 12 schools should simply work with the health department on the guidelines for CDC and current local conditions. Pre-K schools follow FSSA guidelines. We don't, and the Indiana Department of Health does not set guidelines for them. And then, of course, all schools should monitor for outbreaks, changing trends, and consult with the health department regarding guidance and best practices. And school systems should carefully consider how to roll out changes in their policies to make the transition smooth as possible. In terms of gathering sizes, caution is advised with any large crowded events held without masks, especially indoors and when distancing is not possible. Air filtration, we've had this in our order as well, that consider good ventilation, that's still an important system and measure to consider. Other recommendations that we put in here: if you're at high risk, talk to your doctor, see if you're a candidate for treatments or other precautions. Wear a mask if you have symptoms, you've been exposed. If you have a positive test, isolate, wear a mask. Ideally, select a respirator type mask, such as an N95. Not available, wear the best fitting mask that you have available. And develop a plan for getting tested rapidly if it's needed. So this kind of goes to Dr. Pritchard's point. Think now about how you will test if you need to. If you haven't already ordered your free at-home test kit, please do that. And then I believe they are going to make more of those available to homes as well. So that should be coming as well. Consider using video or telephone conferencing when space is limited or transmission rates are high. And then assess your risk and choose strategies accordingly. Consistent use of layered mitigation can limit the spread of COVID-19. And the intent of the board is to provide helpful and uniform health guidance to the county residents in order to protect public health in Monroe County. The current health order, last updated, is repealed and replaced with these recommendations, and that you would like to thank the Monroe County residents who have taken actions during this pandemic to protect themselves, their families, and others. We recognize and understand that the efforts have not always been easy, and we appreciate it. And that's what we have in here. And certainly, as with any order, you can always revisit, and I would assume that you will meet, probably continue to meet monthly, at least in the short term, so that you can get updates. And if we see things taking a turn for the worse, you can meet with 48 hours notice.
Okay. Thank you, Penny.
Does anybody have any comments or corrections or things they would like to change in the order? I think they did a great job.
I do too. I reviewed it yesterday because I thought yesterday was Thursday. So I've had some time to think about it. And yeah, I'm happy with that. And, you know, I think the board has shown that, I mean, if another crisis does face us, we're going to be more than ready this time. You know, we won't have to be reinventing a wheel or anything, you know. So yes, I want to also just quickly say that I want to thank the residents of Monroe County for being patient. It has been hard. It's been a trying time for all of us. And, you know, to go back and resume as normal lives as we can, with the knowledge that we do have and keeping ourselves safe, it's a good thing. Today's a good day. And like I said, and the health department, you know, Penny and the staff and, you know, everybody that's just been involved. Big thanks to everybody. And we're not off the hook. I don't want to make it sound like it's a farewell speech to COVID or anything, but I just want everybody to know how much I appreciate you. So thanks. And to you too, my colleagues here on the Board of Health.
Thank you.
If I could, I'd like to mirror the comments and you know, kind of thank everybody for their patience, but also to recognize that patience really paid off with Monroe County being, you know, a little bit more aggressive towards this and extending the mask mandate a little bit longer than other counties. If you look at our statistics, our deaths, like what, you know, we actually got our money's worth out of this by preventing illness and death. So I'd like to, you know, down the road, I'd like to see some academic studies about this across counties and their actions that they took in regard to this pandemic and the outcomes. So it may seem like a little bit, you know, kind of top down, but it has a result. It has a good result.
Yeah, I'd like to say, one thing I would like to say is that just because we're getting rid of the mask ordinance doesn't mean that we're over. I mean, COVID is still out there, and I think one of the things and if I missed this in the recommendations, I would recommend that businesses post signs recommending the use of masks, and particularly for those people who are at high risk or unvaccinated, because they're the ones that are going to get the sickest. They're the ones that are who will take up our hospital beds and push out other people's surgeries and treatments. And I just think that this isn't the end. This is just a slight change, and it's not going to change my behavior in the least. I'm going to still wear my mask when I go out. And I was in business this morning who said that they were going to still require masks, and I actually told them about the flyers. They were very excited that there were some flyers they had to put on the door. And like, and I'd like you to share those with us, Penny, when we're done with this discussion, because I think that the group did a really good job with them.
I agree with Ashley, Mark, and Carol, and I think the citizens of Monroe County will appreciate the change, as will we all, to optional masking. But at the same time, this layered approach is definitely the way to go, the way to mitigate an issue of this kind as we go from epidemic to pandemic to endemic. Infection is going to still require attention, as it does with influenza and many other diseases.
Right. And to mirror Bob's response, that we will keep a track on things. We'll watch the water, and we'll watch it every week. And like Penny said, we can have a meeting in 2 days if we need to. So we'll watch it very closely, and it's not over. We're just making a slight change here, and hopefully it works out well for everyone. Steve, do you have something you want to say?
No, I was just scratching my face. No,
Okay,
I think
Penny.
everybody said what I needed to say, so that's
Okay.
great.
Penny, would you like to show the flyers? That'd be great. Can we make them smaller? There we go. There, okay, good. We can scroll up those, that'd be great. Can you scroll down on those so we can see them all? Great, thank you.
Some that just want to encourage them a little more. Some may request it, but they're not going to require it. Again, masks encouraged if you're at higher risk or unvaccinated. Here's one just that the Board of Health strongly encourages wearing masks indoors. Masks are encouraged. Please wear a mask in our store if you can't social distance. And did you remember your mask? So, there's a whole host. Some businesses, their staff is still going to wear masks to protect them. And then just masks are always welcome. So there are a variety, and certainly if a business has a need and they need a little help and have an idea, we're happy to help them come up with something.
I think I need that. Did you remember your mask thing stamped on my palm or something? Because I get to the door of businesses even after all this time, and I go like, oh, it's in the car.
How many times do you turn around? How many pockets have masks in them? I mean, how many of our jacket pockets have masks in them?
All my coats, everything.
Yes. So the other thing, and again, I really like the one that says, people are going to be, it's a choice whether you wear a mask or not. And we need to be nice to people who are wearing masks. I don't know if you all saw the Florida's governor's thing with a bunch of high school kids giving them a bunch of grief about wearing masks. I mean, come on now.
Well, and we need to
ridiculous.
also remember that influenza has been at its lowest because we've been wearing masks. So, the masks also help prevent from other illnesses and diseases. So, be cool, wear a mask.
Yep. Okay. So do we need to actually vote on these recommendations, don't we?
If you want to sign them, yeah, I think that
Yeah,
you
I think we
wanted
do.
to approve them, so.
So I guess we need a motion.
I would move. Oh, I'm
Okay,
sorry,
go ahead.
Ashley,
No,
go ahead.
Stephen. Go ahead, Stephen. You go right ahead, sir. I'll second you. How about that?
Okay, I would move that we adapt the recommendation for mask wearing in Monroe County as written, and it will replace the regulation which is expiring.
I'll second that.
Okay, great. So we have a motion and a second. Any other discussion?
Well, in addition to the masking, we should also be cognizant of the vaccination recommendations and social distancing. We just can't go back and, have a, naked swimming pool party. We gotta keep the distance. So
Yeah, that's actually all addressed in the recommendations too, which is great.
Yeah.
It's not just asking. Okay, so we will vote. Ashley,
Yes.
George,
Yes.
Kay,
Yes.
Mark,
Yes.
Steve,
Yes.
Bob,
Yes.
And I vote yes as well. So they've been passed. And and Penny, I assume that you'll let the businesses know that those flyers are available. I
Yes,
assume
we
you have some
will.
sort of network to do that with.
We will, and we will post this tomorrow. We'll get your signatures, Dr. Sharp, and your signature. And then we have a press release. So we'll send those, we'll get those signatures and send that out tomorrow morning.
Okay. Sounds good. So
Thank
any
you
other-
very much, Penny.
Yes.
It's been a
Yeah.
team effort. Kathy put in lots of time, and then the CDC came out with changes and we had to go back and revise it, and we
And our
had
numbers
lots of eyes
changed.
on it. Yep, lots of eyes on it, so.
Okay.
Good
Are there
job.
any other board member?
I wanted to ask Penny about influenza in Monroe County. Have you heard much about it? Because I just got over the flu and it was terrible, and I had my flu shot and I wear my mask everywhere.
Yeah.
And that's,
You know what? I have to admit that I have not looked at the influenza flu, the flu view this week. I was out several days and I've not looked at that. There's not been, at the state level, there's not been indications that we're at a high level of influenza. We did have an uptick early in influenza, so we're really coming into a time when this would be a normal time for us to see quite a bit. So it's another good reason nonetheless, right, to wear our mask and keep some distance and wash our hands. And to your point, all of those things don't necessarily mean that you will not get infected, but it's probably going to be a milder case if you do.
I didn't feel like it was mild at all.
Okay, we haven't really done any public comment, but I did notice that Ashley knows that somebody has their hand up. I think we could probably take some public comment, keeping in mind that we're limited to 3 minutes and we should be respectful, all those things. So you want to, Jonathan, you want to allow there, and I appreciate if you would identify yourself, where you're from, and perhaps show us your lovely face so we can see who's talking. They can't do that? They can't show their lovely faces?
I think they would have to be elevated to a panelist to do
Okay,
that.
well, at least identify who you are and where you're from, please. Go ahead. This says B Square, so who are you?
My name is Dave Askins with the B Square Bulletin, and I do not have a lovely face to show you. I'm sorry.
I'm sorry to see it.
One thing I just wanted to pass along, Kirk White mentioned some legislation that was looked like it was on course to be signed by the governor. Nikki Kelly, who's a reporter with the Fort Wayne Journal-Gazette on Twitter a couple of minutes ago, reported that he had in fact signed it. So whatever hurdle there might have been to letting the governor's order expire, it looks like that hurdle has been cleared. I did have a question that I wanted to ask, and I understand that there's no legal obligation for you folks to get questions answered. There's not even a legal obligation for you to let folks talk. So it's great that you allow that, but I wanted to ask it anyway. A health order nowadays, because of the action in the state legislature, requires the ratification of the 3 county commissioners in order to take effect. You rescinded this order today, and I'm just wondering, technically, are the commissioners going to have to come back next Wednesday and ratify that rescinding of the order, or is it different for rescinding an order versus imposing an order? Thanks so much.
Unfortunately, our attorney is no longer here, I don't think.
Yeah,
that'd be a question for him, but go ahead, Penny.
Yeah, my understanding, Dave, is that it does not. It would only be putting in the order. The board could still rescind it. But if that is different, I can let you know tomorrow.
There's a couple more hands up. I think we can probably take a couple more comments. Again, there's Angela Northcutt, maybe?
Yeah.
Yes, I'm here.
Yeah, go ahead. So
Yeah, my name is
Who are you and where are you from?
Wilmington currently. I've just have been listening because I want to know what's going on. I'm a little in shock that a couple of the gentlemen agreed to the removing the mask mandate, but felt the need to say that we need the possibility of the future to whip out a mandate. It's just a little disappointing for some of the citizens here in this town. I would like to thank, I've been on other meetings, and I'd like to thank Mr. Mark Norrell for being a voice of reason and for taking a stand previously and trying to attempt to remove the mask mandate a few weeks ago. I think that parents of the local school systems really appreciate that because we don't have a choice. I also, one thing, I wasn't planning on talking about this, but just because I was looking at all the signage that you had made for businesses, and one of them just talked about how if you're vaccinated, like you don't have to wear a mask, but if you come to my building and you're not vaccinated, wear a mask. You're all scientific people, and there's actually data that says otherwise. There's a article in Lancet, which I could find for you, from January of 2022 that said basically the impact of vaccination on community transmission of circulating variants of SARS-CoV-2 appear not significantly different from the impact of unvaccinated people. So I just wanted you to know that I see Dr. Wren shaking his head, that data is out there and it's in the Lancet. So, people can have, there's differing opinions from all of you, just so you understand that. And, as you know, I just feel like it's crazy that this is so controversial. The CDC has admitted that cloth masks don't work, yet our children go to school every day with these masks. I feel like no one here is standing up for our kids. The CDC mask study that has been cited over and over by the Board of Health and by Ms. Cottle has huge flaws in it, which I'm happy to send you information on that too. The CDC has guidelines on their site for the public and local government to understand what is recommended. But to me, it doesn't seem like the purpose is for local government to make mandates on their citizens. Did you know that the United States is one of the few Western countries mandating masks on their children? Now, some of you probably don't have small kids, but you need to realize this is a really big deal. There are about 11,000 school-aged kids aged 5 to 18 in our county. Your decisions as a board directly affect our young children. And at a time like this, it's been proven that masks cause psychological and emotional harms beyond repair.
Angel, I don't want to interrupt you, but you have about 20 seconds. If you would just finish up, Bridget, thank you.
So if there's risk, there should be choice. And this is a fundamental truth of bioethics, which all of you scientists should understand. We all have the right to understand the risks and decide for ourselves whether we're willing to accept those risks. And it's amazing that nearly every other county in the state of Indiana has allowed their citizens to weigh COVID and masking risks, but Monroe County has not.
Thank you, Angela. Okay, I do appreciate your comments. And we don't know what's going to happen in the future. So, and I do have a lot of empathy for the issues with children as well. So, again, the mask ordinance has been rescinded for now. We'll see what happens in the future. We have, looks like, do we have anybody else?
Candace Sampson.
Okay. Hi, Candace, go ahead.
Hi there. I do live in Bloomington. I'm actually a 5th generation Monroe County resident, so I've been here for quite a while. So I want to echo everything that Angie Northcutt stated, and I also just wanted to point out so many things. Where do I even start? Well, first of all, Mark Norrell mentioned, hey, that sort of stating that although Monroe County has been more strict, he said that this actually worked, and he hopes to see studies in the future to show that the measures that have been used in Monroe County were actually, beneficial and resulted in lower cases. And I would love to see that too. And I don't know where he's getting, the idea that it has been better, but I think that's really crucial in that what it seems as not just within Indiana, but the entire country. There have been lots of data, over the several months that have shown that places that had very strict measures in terms of masking, social distancing, closures, all of that, they didn't have any better results in terms of COVID rates, deaths, all of that. So again, it seems like some of, the people that are imposing these ideas, I know you refer to the CDC and these big bureaucratic agencies, and that takes the blame, off of you. If something goes wrong, you just say, oh, we defer to them. But really, leaders of our county and our state should be taking all of the information, including whatever guidance, science, and not just one-sided science that's paid for by the government, but multiple bits of information, and then making decisions based on the good of everyone and the good of public health in general, not just being obsessed with a virus. Okay. And then another person made the comment about, oh, hey, the masks were the reason that flu cases have been, non-existent. I really don't think that's proven. I think that maybe that's a nice anecdote that someone, may or may not be true. So let's, if we're talking about being, doctors and scientists and making decisions for the health of everyone, we really need to be a little bit more discerning with our blanket statements that are not proven, that you don't have data to support. And especially I'm concerned that there's a few cases, something happens and then, hey, oh, mask mandate back on. Where's the proof that those masks are helping? Where's the proof that to support these restrictions that you want to impose? We'd like to see proof next time about that we did better off than, let's say, another county in Indiana with similar demographics, similar size, similar, age of population, that they didn't do the measures that you did, and we did. We were a healthier county. We need to see that before you start imposing additional restrictions.
Thank you, Candace. Your timing was perfect. You hit 3 minutes on the nose. Do we have anybody else? I'm having trouble getting my phone to stop now. There we go. All right, I got it. Sorry about that. We have anybody else? Looks like we have.
Yes, somebody with a P. Robinson.
Is that what that says?
Yes.
Yeah, can you hear me?
Okay, give us the whole name. Thank you. Thanks for your comments.
Yes, my name's Perry Robinson. Hey, this is kind of more like for Penny. I think Dave kind of hit on this. I kind of caught it the last second. As far as the county commissioners, would they not have a special meeting tomorrow to kind of throw this out there for the community, to let the community know, Penny? Because if I'm not mistaken, I believe the health department is only recommendations. Am I correct on that? And also, I think you had information on the bleacher pool and the Dillman Road and the testing on that. Are we testing just in that site, or are we testing like the creek water too that is coming out of that site? I was just wondering about that. But that's really about all I had. Thank you.
Go ahead, Penny. I think you should look at the site for your answer to where they're testing this. Basically 2 spots. There was a web earlier in the meeting. Penny presented the website for that.
Okay, right. Yeah, I thought she did. I come in just a little bit late, and I think it just went down. Sorry about that, Penny.
No, it is with the city utilities. They are doing that, and so all of that information is available through their site.
Okay. All right.
And they're moving to a federal program so they're kind of changing programs in the midst of that. So it could possibly change, and I honestly don't know the answer to that.
Right.
In answer to your question, the commissioners, all public meetings require 48-hour notice, but in terms of rescinding the order, there isn't a need to go back before the commissioners, only to put it in.
Only to put it in. Okay. Thank you, Penny.
Yep.
Appreciate it.
Okay. Anybody else? I appreciate. Oh, there's somebody else. Looks like a Paul Miller, maybe. Go ahead, Paul.
Good evening. How are you?
Good. Thanks for joining us.
Yep, no problem. There's a couple things I'll just say in regards to it. One, the one thing that was talked about there by the board tonight was talking about the governor and his, holding his cards as to the you know, whether or not to remove the mask mandate due to legislation. The net is we should not be pawns. All right. We should not be, you know, well, if I don't get what I want, then you're going to take this away from me. This all should be about our personal choices and freedoms. The second thing that I will discuss here is really about probably the more important study that will come out probably in 20 years. That's the one about all of the effects that have been with the mental health of our children. All right. The effects that the last 2 years of policies and procedures and protocols that have absolutely damaged irreparably their mental health. Quite frankly, I mean, you know, it's very disturbing. It's very upsetting. You know, I've got a daughter that will not wear a mask starting tomorrow because she doesn't want to. I've got another daughter that, you know, I asked her, I said, why do you wear a mask? And she said, you know, you got to understand, she is a preteen. She's going through puberty. All right. So she's hiding behind the mask. And she straight up told me that. All right. So in other words, we've given her a Band-Aid to, you know, not, I guess what I'm trying to say is, you know, it's given her a crutch, if you will, to hide behind. All right. And it's really sad. All right. It is absolutely sad to me because she doesn't need it. She doesn't need it at all. But because, you know, somebody has told her to comply and somebody has told her to do something, she's found a security blanket. All right. I don't, you know, I don't understand. And this is just one example that I am personally dealing with on a mental health standpoint. All right. There's going to have to be healing that is going to have to go on within my own daughter that lives with me. And you know what? I am a pro-choice. You want to wear a mask, wear it. But if you don't want to wear it, you should not have to. So with that, I'll leave you with that. Like I said, the true study that I want to see is the one that unfortunately, you know, it's probably going to be out in about 15, 20 years. And we're talking about the damages that have been occurred by these instances. So I tell you, I have reservations and concerns about the idea of, well, let's whip out the mask. Let's whip out the mask. It needs to go away. And it really does need to go away permanently.
Okay, thank you, Paul. Your time is just about up here. And I appreciate your concern. I'm really hoping with getting rid of the mask mandate, at this point, hopefully we won't have to go back, and that'd be great. And also, I mentioned in the chat, if Kendra put in the link for Bloomington Utilities for the wastewater monitoring. So if you're interested, you can look at that as well. I appreciate everyone's comments. I hope this works. I'm very excited that we can try to move forward to a different level of endemic versus pandemic. But we do need to set another meeting, unless anybody else has anything else they want to say. Okay. So let's look at our calendars. 4 weeks from today is the 31st of March. Does that work? Penny, when do we need to have other non-COVID business going on? What's next?
Well, typically you would normally meet like the first Tuesday of April. So, you know, if you wanted, you could meet the 31st, or if you wanted to, I don't know, maybe meet April, if you like Thursdays, even April 14th or Wednesday the 13th.
I mean, we don't have to stick to the Tuesday meetings. We've just done that for the last decade, several decades, actually.
Yes, exactly.
I remember.
You seem to be liking Thursday.
It seems like Thursdays seem to be working better for people, though, for some reason.
Well, and Thursday's not council.
Yeah.
So
maybe,
that really helps
Thursdays.
Penny. That helps Penny out.
I could do 4 weeks. I can't do the first Thursday in April. I could do.
So the 31st or the
31st is in 4
17th.
weeks. Could that count as our April meeting? That's close enough, don't you think?
Yeah. Yeah, you're not obligated to an April meeting, so it's however you want to set them.
Yeah, I'm good for 4 weeks. How does everybody else feel about that?
It's fine with me.
Anybody have any issues with that date? Awesome.
Which date?
It'll be March 31st.
31st? That's okay with me.
That's okay with me.
At 4:30?
4:30 work for everybody?
Sure.
Awesome. We have a date.
All right.
Thank
And
you
they'll
all for all your
probably be
input.
in person too, folks,
It
right?
Okay,
probably
that
will
was
be
my question.
hybrid. Yeah.
Now, but since we extended the order for another month, can we do it on Zoom?
Well, I may not. I will see. You can definitely remember you put in the policies for hybrid meetings, so you can choose to do a hybrid meeting. We'll follow up and do the posting accordingly, which would mean that some of you would need to come and be here in person, and some of you could be via Zoom, and certainly that would make it easy for the general public to join via Zoom as well. Our
Can we
meeting
do
room
the
is
whole
now
thing? Can we do the
small.
whole, can we keep the whole thing in Zoom?
Yet to be
If there's
determined.
orders?
I think we'll have to wait and see what happens.
Yeah, okay. I'd like doing them on Zoom. I can see everybody's face. It's nice. And then actually, I think that we get better public input when it's a Zoom too, frankly, so.
Well, it's easier for public input, certainly.
Yeah, yeah. So, my personal preference would continue on Zoom as long as we can do it. I don't know what y'all think about it. I'm not that excited about seeing people. Not that I don't love you all, but I do. It's just, I just find this to be a better format for me. Part of this because I would be one of those people on Zoom anyway. So
And we
I've
get to
done some
see
hybrid
everybody's
meetings and
pets.
they're really hard.
We get to see Ashley's dog and my cat's tail as he walks across.
Yeah, exactly.
Yeah.
Exactly. And I've done a couple of hybrid meetings and they're just difficult, I think.
All right, so place to be determined.
Yeah.
Yes. Okay, I'll get back to it. So it feels like everybody feels like they'd be okay doing it on Zoom if we're allowed to do that.
Oh, yeah.
It's
Okay.
fine.
All right. So that's what it looks like looking at everybody's face here.
Yeah.
Okay.
Okay.
So that'll be our preference if we can do it, Penny.
Got it.
All right. Sound good. All right, great. You guys have a lovely evening.
Thank you.
Thank
Be adjourned.
you.
You
Thanks
too.
a lot. Bye.
Bye, everyone.